matters that we received a presentation on. First, it was the AG's presentation on the 7th of February. And then we requested the department to react to the AG's presentation. That happened on the 17th. In the same meeting of the 17th, we invited Sahpra, the South African Health Products Regulatory Authority, and to come and share with us their role in matters such as the one that was before the portfolio committee. Today we members had the opportunity to ask questions, but with time we were unable to deal with all the replies. So today we're meeting again just to look at the replies and then decide on the way forward. Invited at or requested to be at the meeting, the agenda meeting, is AG's office. It's Sahpra and the Surgeon General, Lieutenant General Dabula, and the Chief of Logistics, General Shablani Mbuli, and the CFO of the Department of Defense, Mr. Siphiwe Sokela. And the minister will make a concluding remark at the end of the discussion on the matter. So that's Brian. May I invite you to flight the agenda, please? Right, so this is the agenda for today, a very ambitious agenda. It starts with opening and welcome, apologies. 3 is the continuation of the meeting of the 17th. So we'll take 3.1, responses by AGs on the issues emanating from the engagement on the DOD, that is Department of Defense, procurement of Heberon truck, and then 3.2 responses by the South African Health Products Regulatory Authority on the same matter. 3.3 is responses by the Surgeon General on the same matter. 3.4 responses by the CFO and the Chief Logistics on the same matter. And then concluding remarks by the Honourable Minister. We have item number 4, consideration and the adoption of minutes. We'll go as far as we can, but there is that last item, the annual report for 2020. I don't think would get to that item. I would prefer that we postpone it to the next meeting, if the meeting agrees with me. Colleagues, this is the agenda I'm putting before you. and subject to the proposal that I'm making, that we defer the annual report, the committee's annual report for 2020. Colleagues, can I get your reaction to the agenda?
Supported.
Thank you so much. Any objection? There's no objection. All right, Brian, can we then deal with apologies? I want to believe, Brian, we are correct. I'm sorry that we've launched into the serious matter even before I could ascertain that.
That is correct, Chair. We do form a quorum.
I assume so. We do form a quorum. Can I note apologies, Brian?
We have not received any apologies, Chair.
I've not received any apologies. All right. Okay.
I'm sorry, Chair.
Yes. No. I was just looking on the participant list.
Chair, except for the request that we have from Sahpra, wherein they request to be released by 11 o'clock.
Okay, no, it's fine. I'll take note of that. Let me, on the attendance list, I see that the minister has already joined the meeting. Minister, good morning and welcome.
Good morning, Chairperson.
Good morning, Minister. Thank you so much. You're welcome. Thank you. Thanks. And from the AG's office, may I check who's present?
Good morning, Honourable Chairperson and members. Today it's myself, Lawrence van Vieren, and then our Deputy Business.
You. Is it? Hello, Brian.
We've just lost.
Oh, I see. Okay, I thought the problem was on this side. Okay, we lost him, but he was saying that he's the only person representing AG's office, and that's the Deputy Business Executive, Ms. Tsotetse. I think he was about to tender the apology on your behalf. All right.
Chair, I see that Ms. Tsotetse is in the meeting.
Who's in the meeting?
Ms. Tsotetse.
Ms. Tsotetse, yes. Yes,
good morning,
Tsotetse,
sir.
you are in the meeting. And Mr. Lawrence.
Yes, good morning, Chair.
Yes.
Yes, Chair, I'll be joining the meeting and Mr. Lawrence will join us. I think it just have some connection problems. And okay. There's also Ms. Krishna Janssen van Rensburg, who's from the performance audit. Thank you.
Okay, it's Ms. Janssen van Rensburg. Please, Brian, take note of that. Let me just go to Sahpra. Sahpra delegation. AG's office, you are welcome to this meeting. Sahpra.
Good morning. Yes, we are here. I'm here. Just want to check.
Okay.
With our board chairperson, the deputy chair of our board, and another board members, as well as myself as the CEO and board secretary. Okay.
Professor Rees and other board members and the CEO, Dr. Semete, you are all welcome to the meeting. Thank you very much for taking your time out to honor this engagement. Thank you so much. All right, and then we would have the representatives from the department. All right, right, colleagues, having noted that and welcomed all who are the participants today, let me then start with the responses by the AG's office on the issues, followed, maybe I will then check if there are any questions before we move to the responses by Sahpra. And I will ensure that we deal with Sahpra before 11 o'clock. So we conclude with Sahpra before 11 o'clock. AG's office, over to you. Thank you so much.
Thank you, Honorable Chair and honorable members, for granting us this opportunity. The reason why we asked for the opportunity, Chair, was to clarify what he noted as a misunderstanding from last week's presentation or a misinterpretation of one of our findings. The finding relates to the post-importation procedures, and in particular, the fact that we reported that 40% of the vials, their integrity may possibly be compromised. So, Chairperson, we just felt that we needed to take the committee through the finding as indicated in the special report that was tabled in December. The findings relating to the Department of Defense were included on pages 123 to 135 in that special report. So I'll be taking you through the finding as reported in pages 127 to 128 of that report that was tabled. So, Chair, what we reported in terms of that finding was that the department did not test whether the drug was transported and stored at the required temperatures, because according to the product specifications, the drug was to be at all times stored at a temperature of 2 to 8% degrees Celsius. So what we noted when we were doing a walkthrough in the depot where the medication was kept was that there was an indication, there was a device that shows that some of the batches of the medicine were at some point exposed to temperatures that were above or below the 2 to 8 degrees Celsius that is required per the product specifications. So how this is indicated in the batches is that the device shows a cross or a sign of a correct, which means that if it's a cross, it means that the drug may have been exposed to those temperatures that are above or below the required temperature. So we then counted all the items that were exposed to the temperatures outside the required range, as well as the duration of how long they were above or below the required range. So in our analysis, we then found out that 387,000 of the 895 vials were indeed exposed to temperatures outside the required range during the transportation and or the warehousing thereof. So what we reported was then that the department did not detect this breach in the cold chain, because they were then supposed to determine whether what is the impact of that exposure of the medication to those temperatures, which will then have an effect on the integrity of the drug. So in most of the instances, we noted that the drugs were exposed to those temperatures that are outside the norm for more than 20 hours. So our recommendation then in terms of this finding was that the department was supposed to then investigate all the instances where the cold chains were compromised, so that they determine the impact on the drug's effectiveness and the integrity, and to document then the results of that investigation. So, Chair, this is the one finding that we felt was misunderstood or misinterpreted based on last week's presentation, and this is the only finding then that we wanted to explain to the committee. Chairperson, I also want to give some feedback regarding the information that was requested from the department and was not received. So subsequent to last week's meeting, we did obtain some of the information from the department, and there's still some information outstanding at this point in time. Thank you, Chair.
Thank you very much. Okay. Colleagues, these are the responses from the AG's office. In fact, they are clarifying what could have been a misunderstanding in the last meeting. It's not a new issue. However, they are also saying that not all information has been obtained from the department. And now, I don't know. Is there any reason why they have not given you the balance of the information?
Chairperson, I would like maybe Ms. Krishna Janse van Rensburg to answer that question, because she met with the department last week and received some of the information. Krishna, thank you.
Okay, Ms. van Rensburg.
Thank you. Good morning, Honourable Chair and members. Thank you for the opportunity. Just in short, since last week's meeting of the Portfolio Committee, we did meet with the department and we are in process of clarifying exactly what information is still outstanding and what additional arrangements should be made. As and when the information was also submitted, we analyzed the information to see whether it supports what we are looking for as corroborative evidence. So we are in constant engagement with the department to follow it up further, to make sure that we receive all the required information. So it is a fact the department did submit information, and as we analyze, we go ahead and say, can they please provide more information? There's also other information that they did not provide to us because they need to get some further approvals to make it available to us. Thank you, Chair.
Okay, nice. All right, colleagues, that's the information from the office general. Are there any on this before we excuse them?
Chairperson, can I just find out the submission? So do you want to excuse the Auditor General from the meeting before we interact with Sahpra?
Oh, no. Before we move to the next, before we move to the next, before we move to Sahpra.
Before we move.
Yes. Well, look, they will be free to leave. They'll be free to leave the meeting because we'll be done with them. That's the point I was actually making. Yeah. But of course, they are always welcome to sit in.
Thank you.
Yes. Trust. Right. No, thank you very much, AG's office, for this. And please keep us updated on your discussion with DOD on the outstanding information. All right.
Just with your indulgence, can I maybe just ask the Auditor General? They have indicated to us that there was a device that they saw that indicated there was a time, at least 20 hours outside of that 2 to 8 degrees that it was supposed to be stored. You know, what on that device, or maybe just to understand that a bit better, because you know, according to the department last week, I mean, they obviously totally disagree with that, or last week disagreed with that. So what on that device? Was it a report from the device, or how? Just for me to understand that what made them, you know, say that specific amount of veils, and that's why the 40% was put into the December report. That I just understand exactly what happened there, and how they could, I mean, from an informant's point of view, use that information in the report.
AG's office.
Thank you, Chair. Chairperson, that device then has an indication, like I tried to explain earlier, that it will have a tick mark or a cross. So the cross then indicates that the medication may have been exposed to temperatures that are outside the required range. So we then followed up all the ones that had crosses to confirm if indeed it shows that the medication was exposed to temperatures above 8 degrees Celsius. So we confirmed then with that analysis that indeed those medication amounting to 387,000 were exposed to the temperature. So the device actually just shows that tick mark or that cross. So the crosses ones are the ones that were exposed to the temperatures outside the range. And we did also just test a few of the ones that had a tick mark to confirm that it indeed shows that they were within the temperatures, and that we confirmed that those ones with a tick mark were still within the required or expected range of 2 to 8 degrees Celsius. So that device is visible on all the batches of the medication that was shipped from Cuba to South Africa. Hence, we used it then to follow up and analyze the exposure of the medication to temperatures that may be outside the required range. Thanks, Chair.
Okay. Thank you very much. The question is whether the department did make a follow-up on that. If they did, what were their findings? All right. So the Surgeon General will talk to this aspect, amongst other things. I'm sure Sahpra, maybe they're also qualified to talk to the issue, but we'll hear from them. All right, thank you very much, Ms. Sotetse. And now, can we move off to Sahpra, Professor Rees? There's a hand, Ms. My apologies, colleagues. Motise?
Thank you, Chair. You must also check on the participants icon there. There's also a hand of Ms. Bucas. And she would have.
Oh, I see. No. I will then take Ms. Bucas.
Okay, thank you, Chairperson. I wanted to check with regards to the storage for the medicines. If the department has a facility of its own to store these medicines, or are they then getting a facility from a service provider, and at what cost? Who will bear the costs for that facility? And I'm asking that to say the medicine was procured for a certain period, I assume, and now that it has not been provided to all the number of soldiers that they would have procured for, it means it is still stored in bags. And will that not then cause an audit query for storage costs that the department is bearing currently? Thank you.
Okay, thank you very much. Ms. Motise, sorry, Ms. Bucas.
Thank you, Chair. Chair, I'm struggling with Vodacom, so I'm trying my best. But my first one is, Chair, on the reports, on the documents that the department was supposed to submit to the AG. Last week, they just say that they will submit the documents, and they did not say they will submit part of the documents. And I think, Chair, it's really the reluctance of the department on the accountability is worrisome. So I just want to raise that concern. Secondly, Chair, the AG was asking for investigation on the exposed drugs and the impact on the drug. Did they receive that report on that investigation? Thank you, Chair.
Thank you very much. Okay, so the two questions, Motise's questions will be answered when we get to the responses by the department. Oh, yes, because they will be in a position to tell us whose facilities are those that they're using to store, to warehouse or store the drug. And then the issue of them not furnishing all the required information will also be dealt with them. I think it suffices for AG to indicate where they are with the department on these issues. So deal with them. In other words, we're still going to come to these issues later when the department is opportunity to respond. All right. I hope I'm correct, colleagues. Let me just look at my list. It doesn't look like there's any other hand. Ms. Bukes, I did not pick your last question. I hope I'm doing justice to it. Can you just repeat it? My apologies.
Chair, the AG said they were asking for investigation on the exposed drug and the impact of that exposure on the drug. So what I'm asking is, did they receive the report on that investigation?
Okay, all right. No, it doesn't look like they've received it because they are saying that they left it at that when they filed a report indicating that about 40% of the stock might have been exposed to temperatures outside the range. They are saying the department was supposed to, investigate and determine the impact of this. So they've not come back to them, but the department will respond. What did they do when they received, after they received this particular concern from the AG's office? We'll deal with that when we deal with the responses from the department. All right, so we are done with the AG's office. AG, you are welcome to stay in. May I now move to Sahpra? I know Sahpra will just leave at 11. Sahpra, it's your turn. Are there any questions or issues of clarity you want to make? Over to you, Professor Rhys and Dr. Semete, CEO.
Thank you very much, and thank you for this important discussion. Sahpra has had a discussion between board members and the CEO and her executive, and we've thought long and hard. We're clearly a regulator, and there are very clear rules set out and prescribed in the legislation. So I'll invite Dr. Semete as CEO to give you feedback.
Thank you very much, Dr. Semete. Thank you very much, Professor Rhys.
Thank you very much, Chair, and good morning, everyone. I just thought I would just clarify in terms of the process that we would, typically follow when there is a product that is unauthorized that's in the country, and then just give an update in terms of where we are on this matter. So when a product comes into the country unauthorized, we would typically be alerted to it at the port of entry, and what we would do is that's when we would be called to the port of entry together with subs and other institutions to go and inspect the consignment. And what we will do is just to check that the importing country has got a license, so they've got the Section 22C license of Sahpra, and are then permitted also to import the product. And what we would do is then, depending on the product, we would then collect samples and do, an analysis to determine what's in the product. If it's labeled, also we would then also retain it. Typically, we would retain it at quarantine it at the port of entry, and the matter would then be investigated. And based on the outcome of the investigation, we would then destroy the product, etc. So that's typically what we would follow in our case. And so with this matter, as we indicated last week, that we had started engagements with the SANDF around this product. Since our meeting last week, we've managed to, this week, I think it was yesterday when the team went, to go to the facility to further inspect the product, because we were not able to do a full inspection. If you remember when I reported last week, that meeting of the 3rd did not take place, and it still hasn't. And so what we were able to report is that the products are kept at the required temperature of 2 to 8 degrees. We've checked the expiry, and they've got different expiry dates that range from March 2022 to July 2022. We've also checked the quantities there's currently about 970,000 or so remaining of these products. So there's specific numbers that the team took into account. We've also taken samples from each of the batch to analyze them, to check the the quality of the product. So we would be able to report to that. So that's the latest feedback as we sit today. And the core message is that this product remains to be an unauthorized product. So we will then be engaging with the NCNDF in terms of the proposed plan of how this product would be dealt once we then get also the results from the batches, samples from the batches that we have taken. I'll pause here, Chair. Thank you. I don't know if there's any specific questions.
Thank you. The question in the last meeting, if I recall, sorry, there was a question that relates to a trial sample size. What is the average? How big must it be? What is the minimum? What is the maximum? I don't know. Maybe you use your own lingua in that, but I'm sure you understand exactly what I'm trying to say. Because the application so far is for trial studies. How big must a trial sample size, whatever it is?
Thank you, Chair. So we haven't received an application yet for the trial. We have met with the SNDF and we provided guidance in terms of what are the requirements. So as of today, we don't have an application yet for a clinical trial. Again, the sizes depend on the nature of the clinical trial. So what we would do is review, what we call endpoints are. So what do you want to demonstrate through the study? And based on what you then want to demonstrate, there's a guidance. It's an international guidance in terms of how many numbers you should have. So for example, if it's a phase 3 study, you would need numbers as large as probably a minimum would be around 30,000 or so, because that's when you are demonstrating efficacy. But we can't at this point say, because the team needs to submit a clinical trial application where they indicate what the endpoints are, and we haven't received that to date.
Perhaps I could just add, the complexity of this situation would be that in a clinical trial where we don't have evidence of effectiveness, and there are no other products other than vaccines, for example, and prevention, which is what is we think was being considered here. The study would have to be blinded with a placebo, and that means that the vials would have to be blinded. And so there is it would probably be very difficult to use these samples, which I'm sure are labeled properly as for their content in a clinical trial, because you would need to relabel all of them and have control and have placebo vials as well. The numbers that Dr. Smeti referred to would be for a prevention study. Different numbers would be required for a treatment study. But at the moment, the design of any one of those studies would differ. But if for a prevention study, given that we do not have, apart from vaccines, good prevention technologies at the moment, that would probably be a blinded study, which could only be done until such time as we've got vaccines rolled out. So this is very complex. And it would be difficult with the current product to just slot it into a trial, and that's why we would encourage, if this is feasible, we would encourage the SAPs to consider what is required, because it would be very difficult to use these stored products. The other thing would be the viability of the products, noting what we've just heard about temperature control. And I think that's something that we would need to now go back and also review. Thank you.
No, thank you very much, Prof. And how long, what is the average time of a clinical trial? So that we understand that in the context of the expiry date.
Well, it would depend on what the aim of the trial was. Many of the vaccine trials where you're seeing these fairly rapid results that are produced in 2 or 3 months are multi-centered. They're global. They've got centers all over the world. So any one center might have 200 or 300. Say in South Africa, where we did vaccine trials, would have. But this, I'm talking about prevention because my impression is that that was the interest for the use of this product. As I say, there is not good evidence in support of this, so it could not be used. It's not an indication that would be used currently. So you would need to generate that data. But the challenge would be that the vaccine trials have been global, multi-centered. In cases such as in China or Russia, they've had access to multiple trial sites within their own countries. But it's a pretty huge endeavor to do a prevention trial, and it's costly. And it requires enormous resources, so human resources and skilled research resources. So I think if that is being considered, and as Dr. Sumeti said, we're still waiting to hear back on that. A lot of thought would have to go into what kind of data could be generated within a sensible parameter, so that it's not overambitious. And I think what you're implying is, too ambitious could be very difficult to achieve, so something that's much more modest. But I'm going to repeat again, if it's a blinded study, which it would pretty certainly have to be, these vials would have to be totally relabeled, which is quite an endeavor, and you'd need a placebo vial as well.
Okay, no, thank you very much. Let me just check if there are any hands on the participants list. Modise, is your hand up, or it was up earlier?
Oh, sorry, Chair. It was up earlier.
Okay.
My hand is up, sir.
Okay, yes. Let me take yourself, Mr. Murray, and then Ms. Peters.
Thank you very much, Professor and CEO. I want to ask the question because I'm not sure I understood the CEO correctly. That it seems like, according to her, there was no breakage of temperature storage. According to the AG, what they've reported is that there is specific facts indicating this amount of vials that was this 40% that was either below or well, at least outside those 2 to 8%. I just wanted to understand that very, very correctly in terms of in terms of the status of the stock that is currently with the SANDF or SAMS. Then secondly, the facility that are being used currently, are you confident that that facility and all the requirements are met at that facility to store medicine, effectively, meaning, the temperatures, but also the control and efficacy of that storage of medicine. Then I also want to find out, you've indicated that normally the inspection takes place at the port of entry. Now, taking the facts that the medicine was brought in April, July, and August, and there's a fourth consignment still outstanding. Can I then take that you were not informed at the time that the medicine was brought in? And if there was any explanation why that didn't take place? Because obviously those officials or state departments that was under obligation to inform you of that medicine when it came in, why did they not inform you, and who are they that did not inform you? So I want to make sure of that. And then you've said that there are huge human and research resources required for this clinical tests and trials. Can you give us maybe more an indication of what are you talking about? Because we must determine afterwards whether SAMS has got the capacity in terms of human resources and other resources, financial, laboratories, etc., to do those trials. And obviously, everywhere where people must be tested and be part of that trials. And then I also just wanted to know from you, my apologies. Yeah, I've asked it on the. Oh, I want to ask from you, if I understood you correctly last week, you have indicated that there, by the World Health Organization and yourself, there was some trials in the past, and that those clinical trials show that it was not successful, and it was moderately successful for moderate cases, but not for hospitalization or prevention for hospitalization. Did I understand you correctly? And if so, why would you allow the Defence Force and SAMS to do a further clinical trial? What do you expect to learn from that you do not already know, and that you do not have already received from the World Health Organization? What do you expect to get from them, and what do they have to provide you to basically convince you in that? Thank you very much, sir.
Okay. No, thank you very much. Ms. Beckers.
Thank you, Chair. Honorable Marie already asked that question about the storage, because the AG was saying that the department did not check whether the temperature was the right temperature, but the Sahpra was saying that it was stored at the correct temperature. So my question is, I want clarity on the fact that was it only on the day of the visit of the AG that there was a problem with the temperature?
Okay. The AG, just to both of you, Marie and Bucas, the AG came back to say their focus was on post importation, where they looked at whether during transportation the drug was, kept at was not kept at temperatures outside the range. They looked at that when they focused on that when they picked up some evidence, the device that they've just spoken about, that has a mark of a tick or a cross, which notifies when the department, when a drug has been exposed to temperatures outside the range. In other words, their focus was not at temperature as it is currently stored, but temperature during what you call a transportation. And then Sahpra came, they walked into the thing, they gained access and found it to be kept at the required temperature levels. I think the two were looking at different. One was looking at the possibility of it being exposed to temperatures outside, the required range during transportation, and Sahpra came in to look at temperature, storage temperature. But Professor Ray said now that there's this concern, they will also look at that and confirm whether indeed some of the medication was in fact at any stage exposed to temperatures outside the required levels. But I will let Professor to talk to that. Over to you, Professor and Dr. and CEO, Dr. Semente.
So I think just to say in the first instance, to clarify why, if WHO has said this is not indicated, why do we need to keep doing studies? I think just bear in mind that this is a new virus. We've only had it for a year. So there are huge numbers of unanswered therapeutic questions. one of the biggest is indeed looking for additional tools for prevention. This would be in addition to vaccines, but better tools for early treatment, better tools for advanced disease, many questions. So what WHO does, and we also have a committee here in South Africa, which is the Essential Medicines Committee, which we have had a specialist committee, subcommittee of, which has continuously looked, WHO and this local committee, continuously look at evolving data. Because all the time there are new clinical trial data coming out, and some can be profound. One study that's really well done can change the way of management and give new indications. Others, if their studies are not done well, just really in a sense cause confusion, because they can go this way, they can go that way, but they don't answer the question. So all the time we continue to review data, WHO continues to review data, and so on. Just to say that in terms of therapeutics, interferon was included in a trial called Solidarity that WHO coordinated right early on in the pandemic, and South Africa has 14 hospitals that participated, and it did not show effectiveness for treatment of advanced disease in that study. But that was interferon. It was a different interferon. It was interferon beta, and these are different products. So that's the WHO, and I'd like to just ask, we have Professor Banu on the line with us, and I'd like to ask him to come in and make a few comments, and then we'll come back to Dr. Samete. But I just would like to say that the suggestion for a clinical trial was because there isn't data. It was to say, is this an option? But I want to reinforce, there's a question of, has it been properly stored? That's critically important. You can see all the efforts we're going to now with vaccines about proper storage. It's critically important. But the issue would be if there was a trial, depending on the design of the trial, but the kind of trial we would probably want to see would be something with a placebo. You would have to relabel all of these products. You couldn't use something that has got the label of what it is, because then the trial is not what we call blinded. We're not able to compare the active product with a control product, which is not active, and blind the person who's getting it and the person who's giving it. So I'll hand over, if I may, to Professor Banu, who wants to add some comments.
Sorry, Professor Banu is a member of the board.
Exactly, yes. He chairs we have a committee that looks at the technical matters and the regulatory science. Yes.
Okay. Professor Banu, welcome.
Thank you, Honorable Chair, and good morning, honorable members as well. I think Professor Rees has essentially covered much of the issues. The context of whether or not a clinical trial is appropriate for these products, I think, probably argues on the basis of the information that's available globally that there is some justification to conduct a clinical trial. I think, as Prof. Rees has indicated, the WHO study looked at a different interferon. In terms of interferons, there are a whole range of different molecules that have slightly varying effects on the immune system and their ability to interfere with viral infections. In the context of this particular interferon, there's only been 2 studies that we are aware of that have been conducted. One was conducted in China, and the other was conducted with the Cuban and Italian investigators. These were, in fact, very small studies that had been conducted very early on in the COVID pandemic that, in fact, suggested that there might be benefit. The interferon that was trialed in the WHO study was, in fact, interferon beta and not interferon alpha 1b as this is, or sorry, this is interferon alpha 2b. So I think the context of whether a clinical trial should be conducted still means that there's a need for data to be collected in a way that, in fact, demonstrates whether this is effective or not. And I think the sort of issues raised by both the chairperson and the CEO is that a study would need to be conducted that is placebo-controlled and would have sufficient numbers of participants to be able to define the outcomes that are being considered for this particular preparation. What I should also say is that there's very little data available globally on the benefit of interferon alpha to be from a prophylactic point of view. So in terms of prevention studies, there's very little work that's being done. I think the point that Prof. Rees has raised around the capacity and the resources that would be required to implement such a study is in fact a very important one, which is why the request to the military to in fact submit a protocol and give us an idea of whether or not there is the capacity and the resources to be able to conduct the trial, I think is quite important, Chair. I think on the issue of temperature monitoring that's been raised by the AG, a very critical one. I think Sahpra's indicated that the assessment that it's been able to do so far in relation to this product still needs to be completed. What Sahpra has been able to ascertain to date is that the product, as it's being stored currently, is in fact under acceptable conditions. What Sahpra has not yet ascertained was whether or not particular batches had experienced temperature excursions, which in fact would be a problem. From a regulatory point of view, it's in fact critical that temperature is maintained throughout the supply chain for the product. And the temperature monitoring devices or temperature loggers that are attached to the product is in fact critical in giving us the information on whether or not these products have been stored sufficiently. I'll give you the example of what normally happens in the medicine supply chain in South Africa, where when a product is received at a facility and a temperature logger suggests that the product has not been stored adequately during that process, that medicine would have to be returned to the manufacturer. And that's the normal process that we have in place. The temperature loggers themselves can give you a variety of information. And I think what the AG is telling us is that these temperature devices actually just tell you whether or not they've been stored correctly. There are in fact more sophisticated devices that can tell us where exactly and for how long these products had not been stored correctly. The concern is that once a temperature logger says or identifies that a product has not been stored correctly, that product generally, Chair, cannot be used and would have to be destroyed. That's the process that we implement in South Africa in terms of how we manage the cold chain throughout the medicine distribution. So I think it's important that we recognize that Sahpra needs to, in fact, further investigate this issue of temperature excursion of the product. I'll stop there for now. Thank you.
Can we get that as a commitment that Sahpra will do a further investigation into the issue of temperature, whether the drug was kept at the appropriate temperature levels at all material times? Can I get that commitment?
If I may come in, and I'll ask Dr. Samete to comment. Even if some drug was and some drug wasn't, we still are stuck with the problem that this was an illegally imported product, a large quantity of illegally imported product. And that is the biggest problem that faces us. We will certainly look, because clearly if things are not viable, there's no point storing them. But we cannot get away from the fact that this hasn't been brought in according to South African law.
Okay, but I thought this question was relevant because when you consider the application of clinical trials, I understand the question, the issue you are raising now. Remember, the discussion between yourself and the department is that if they want to go ahead, they must apply, and they are waiting for that application. Now, when that application comes, this issue then becomes even more urgent, not so?
Certainly, because if there was a consideration, my concern is that, and I'm going to say it again, is that if this was a placebo-controlled trial, all of these vials would need to be relabeled, and a placebo vial would need to be made available. That is not a small undertaking for those of us who've done trials. Getting even placebo products that look the same, etc., is a very big undertaking. So that would have to also be considered. Thank you.
Okay. No, I hear you very well. Colleagues, I think I don't see any other hand. They've indicated that would want to be excused at 11.
Chairperson, I've asked a question with regards to the point of entry notification
yes.
and why they were not notified. So maybe they can respond to that as well, please. Thank you.
All right. If you could deal with that.
There's two questions that I'll address. I think the others were quite adequately covered by our colleagues. So in terms of the facility, I mean, every facility would be, licensed, and because this facility has got a responsible pharmacist, they would then need to ensure that all the authorization as per the Pharmacy Council is in place. And so through the responsible pharmacist, we would then, get confirmation. So in this case, the responsible pharmacists really need to ensure that the facility is adequate. In terms of the point of entry, why we were not informed, if you remember, we indicated that we only received the first application in August of 2020, when the first consignment was around April. And I also alluded to the many engagements that we had been trying to have that didn't materialize. If we were there, we were asked to come back at a later point. So we don't know how come we were not informed. We don't know through which port of entry this product arrived into the country. So as we speak, we're dealing with the product that is currently then at the facility here in Pretoria. And then lastly, I also want to just highlight that the protocol that would be submitted would go through under quite stringent review by our clinical trial committee, which is an expert committee, in this area of clinical trials. So they would look at all of this. So while we have said this can be considered, as Prof. Rees correctly said, there's all of those, considerations that would need to be kept in mind as we will do a thorough scientific review of the application to be received if it is submitted. Thank you.
Thank you very much. I think you have enlightened us. We're better now than before. And thank you very much for your assistance in this regard. I think we can now discharge you. Prof, other board members, you have been very helpful. CEO, thank you very much for assisting the board in being as helpful as it has been in this meeting and in the previous meeting. Thank you so much. You are excused.
Thank you, Chairperson, on behalf of Sahpra. And to the Honourable Minister, we didn't greet you, but I see that you're on the line. So thank you very much for your time.
Thank you very much, Professor Rees. Thank you.
Thank you so much. All right, colleagues, now we are done with the two entities. Now it's time for the Surgeon General, as in the meeting, has listened to all these questions and responses. I'm sure you would also comment on those, but there are also specific questions that were actually directed at him. And I think I understood him to be saying he takes full responsibility of what has actually happened up to this time, and so the official who was presenting on his behalf as the head of the entity. Am I wrong to believe so, such a general, that you take full responsibility of for what happened with respect to this drug?
Thank you, Chair, members of the committee, Honorable Minister, who is also present on this webinar. Good morning. I just want to say that from the point of view, first of all, Chair, I need to say that with regards to the responsibility about the importation and the administration and everything of this drug, the Military Command Council takes full responsibility for that. Now, this is one of the highest decision-making bodies.
Sorry, I did not hear you. What are you saying?
What I'm saying is that the Military Command Council takes full responsibility of everything that surrounds this.
No. I'm asking you. No, we're asking. The question is directed to you.
Aspects.
Yes.
The medical aspects in respect of the drug, the Surgeon General takes full responsibility thereof.
Thank you.
So I just want the portfolio committee to be aware of that. Medical aspects that relate to this medication, the SG takes full responsibility. Now, I think, Chair, I need to say from the beginning that a lot of information has been given to the portfolio committee in respect of the issues that pertain to storage, the responsibility, the responsible persons for that, and everything else that goes around it. The depot is the one which has been spoken about. Is a medical depot, which is just that it's got all the necessary equipment for the storage of this said medication. And in fact, I think if there is necessary documentation that needs to be put forth in respect of its authenticity of existence, that can also be provided. Now, I think what is important again for the committee to recognize is that at the time of the importation of this drug, nobody really knew exactly what we were about in respect of this pandemic. And as such, all possible levels of intervention were actually being put in place besides that of a vaccine. Viral infections, all of us are aware of the fact that the only time that the only thing that is really applicable for the management and containment of viral infections is a vaccine. And as such, the Military Health Service advising the Military Command Council took the position that says that this, as one of the immunomodulators, it would actually assist our soldiers purely because we had to have large numbers of them being deployed in assistance of the Department of Health and together with the other state departments, like the South African police services. So it was essential then that the Surgeon General should make sure that those people who have been deployed at least have got some kind of containment of this pandemic. So I think essentially that is the first thing that one needs to, that is the portfolio committee should be aware of. Now, it is unfortunate that it is being said now that this product remains an unlicensed product. And as such, knowledge of that is becoming abundantly clear, obvious to all of us in respect of this. However, the engagements that we have had with Sahpra now and where we are the engagements are such that they are extremely productive. And I would like to believe that it would be really premature for any one of us to start talking about the numbers which are necessary for the study, for the trial, and together with everything else that goes with it. Because the submission of the necessary protocol, the clinical staff members of the Department of Defense or SENS are working flat out to get this one sorted out. Now, this again, I would like to say, is an extremely complex issue. And the complexity thereof is that it shouldn't really be looked at face value. Does the SEMS have sufficient capacity in respect of now the size of the clinical trial that we want to put in place, and also together with all the necessary research personnel? Yes, we do. And I'm convinced in my mind that we would be able to, after having put the parameters down between Sahpra and the Military Health Service, after having done those and put them down, we should be able then to have the necessary sort of capacity in respect of this. I think I should also say that we are working in collaboration with other sort of academic institutions, especially in respect of trials, because clinical trials, by their nature, they really need a very highly expanded academic involvement and collaboration. And this is exactly what we are doing as the military service. Again, I want to say to the committee that it's really unfortunate that when we come to the issue of temperature regulation, or better still, the temperature conditions of this drug during transportation and also at the storage, we are actually discussing it here in this portfolio committee. I want to say that again, we also do have the capacity as the military service through our research sort of capacity within the Department of Defense to actually do trials of whether the authenticity of the drug had been kept correctly. And to that extent, we are still also in the process of making that assertion and assessment. Now, the CEO of Sahpra has already mentioned that they went to the base depot for the purposes of getting some of the samples for testing, so that at least we are able then to get into the AXA report that talks to 40% of the medication having been destroyed or possibly destroyed. Now, I think it's unfair at this stage for us to talk about any sort of percentage in terms of whether there is any medication, if any, that has not been stored under the correct temperatures. The understanding of the Surgeon General is that there has not been any violation of any of these conditions in respect of transportation and storage of this medication. Now, the size of the trial, obviously, is one of those things that we're going to discuss with the regulatory authority, so that at least we find each other in terms of the numbers that we need to put in place for the trial. And in the last session that we had, there were a number of other questions, Chair, which were asked, and I don't know whether I need to get back to them or just deal with what we've just spoken about today. I think essentially for me, for today, we never said that interferon is supposed to be used as a vaccine or as a supplement for vaccination. Never said that. And from our side, we still believe that this is one of the medicines that will be very highly effective in the management of patients who are not hospitalized for the purposes for me to be able to deploy them. And again, the trial that we're talking about would only be assistive in respect of clarifying some of these questions which are coming out here. Without the National Defence Force being allowed to get into the clinical trial space, it doesn't matter what is needed there. Again, I believe that it would not be quite fair, because essentially what would happen is that we would be having used the cohort that we would use for this clinical trial. We'll then be able to put also some research material into the global space in respect of the utilization of the drug. So, Chair, I think I should end there for now. I don't know, I need guidance from you in respect of the other questions which were asked in the previous session that we set in, whether the Surgeon General needs to have to deal with them, or we just concentrate on the stuff that we've just spoken about.
Thank you very much. Thank you very much, SG. You please deal with the other questions as well that emanated at the last meeting. You may ask other people to assist you in the process. Thank you very much for what you have said so far. Thanks, SG. Over to you, sir, again.
Thank you, Chair. The question that was asked last time is that what has been we are all aware now of the fact that Sahpra gave permission for the utilization of 10 vials of interferon, and the rest have not been used. And the question then was, what has been the effect of the non-utilization of the drug in the National Defence Force complex? I think I need to say that, unfortunately, we will never know. Basically, that's what I need to say. We'll unfortunately never know. But, however, what I know for sure in respect of the clinical efficacy of the drug, one will never know until that has been put on the clinical trial. What I want to say is that the number of infected cases in the National Defence Force during Operation Notlena, which was the one operation that was assisting the rest of the state, as having been directed by the Commander-in-Chief, has been higher than the rest of the members of the national population. I think it's purely because of our direct interaction with the people out there, and so that is that. And what I want to say then that is, again, as a consequence of that, I had to lay down a number of people in the health sector, medical health sector, purely because for the 14-day, which was the initial one, quarantine and also isolation. So, and consequently, I had to rely on the much more needed reserve force collapse together with the other auxiliaries that we had to call out, just to assist in the general, in terms of the fact that since we were not able to use the medication, that I can certainly be able to tell you in respect of what is it that had happened. Now, there was another question in respect of how many soldiers then have been infected and how many passed on. That is classified information, members of the committee, I really can't. But if people would like to have to invoke the use of the Fire Act, the Surgeon General has got this information with him in respect of everything else that relates to the affected cases, the ones who had to be hospitalized, those that passed on, and also the present infection rates in the National Defence Force. I think this is one of the most classified information that I would not like to sort of give out in this particular platform. Now, I've spoken about the reference to national statistics. The only provinces where we did not have large numbers bigger than the National Department of Health was in Northwest and together with Northern Cape. The rest of the other provinces, we actually had higher numbers of cases of COVID-19 in the National Defence Force. Now, I'm not going to deal too much with the issues that pertain to Sahpra, which were asked by the honorable members last time, because I think the relationship between Sahpra and the SANDF is still the one that is a matter under discussion, and there's better collaboration now in respect of what is it that we need to put on the ground for the authentication of the medication. There was also another question that talks to the fact that did the Surgeon General know about the importation of the medication and at the time when it was imported? Yes, the SG knew, and the Surgeon General may not have been sitting in those meetings where this whole issue was being discussed, but he was fully kept abreast in terms of what is happening at any particular step of the way. So the SG was aware. And Chair, I think I'll stop there and invoke the services of Colonel Nisi if there's anything that he wants to say, because he's one of the members who's present here with me. If there's anything else that you want to say, Colonel, if there's nothing, then that's okay.
Colonel Nisi, that is if there are other questions that the General might not have answered from the last meeting.
Yeah. Thank you very much, my Surgeon General, and I acknowledge honorable members and my honorable Minister of Defense. Suffice to say, at the moment, the questions that were asked about the processes between us and Sahpra is to answer that question in particular. The technical team from SAMS has engaged up to yesterday as well with the members of the technical team of Sahpra to iron out the way forward and further requirements for a clinical research which we have to embark on. It has been said and reiterated as well in this meeting by both the CEO and Professor Rees that there is a space and a gap of knowledge, and this is by the other professor as well. This is a new interferon other than the one that was put on trial before, and that this new one would bring in a body of evidence and information that the world hugely need. And we see this as a huge opportunity for which we shouldn't allow the problems that we earlier went through in our tipping, especially under disaster management situation and circumstances we found ourselves in when we were processing application quite earlier, to allow us to actually curtail what would be good to the world. We have gone with a spirit of finding each other with Sahpra, trying to correct what is wrong, making sure that there is compliance. Obviously, the Surgeon General has rightfully said, we are awaiting a report of the integrity of each and every batch representative drug, which has been sampled by Sahpra, which we will also independently sample, so that we know going forth into the research, we are confident that we will be using the drug that has integrity. If obviously the results point otherwise, it is only ethical to declare that and follow what the law would require as stated. I would like to end there and say we are quite geared, and as professionals within SAMS and in South Africa, would like to add to the body of knowledge, as the other professor had said, into what is missing in the preventive aspect of COVID. Thank you.
Thank you very much, colleagues. Let me just look at the participants list. All right. I just want to first establish, I want to satisfy myself that all the questions have been replied to even before we take new questions.
No,
and,
sir.
Mr. Mare, yes. Mr.
No,
Mare,
sir.
there's one. Yes, there's a question, but this one will be answered by Chief Locke. It relates to the existing contract being extended to include medicine.
Yeah.
That's the only one I note as outstanding,
no,
but
not.
it will be dealt with later. Can I just indicate which other one you was not applied to? Before new question.
Yeah. Before new questions. The question I submitted last week was, it's been reported that both this Deputy Surgeon General Ndlovu and General Ford acknowledged at the time that this drug was unregistered in South Africa and unapproved. So my question was, why did the Surgeon General then, as part of the Military Command Council, supported this importation, knowing very well at the time that it was unapproved and unregistered, in other words, unauthorized and illegal, and obviously knowing and are they, and what I've asked is, are they not subjected to the Sahpra rules and regulations as any other pharmacist and any other medicine being imported? That was the one that was outstanding, but I've got other questions as well.
Thank you so much.
I've asked whether he's changed his opinion in that regard. Thank you.
Mr. Mare, yes, thanks. But they will deal with this one. I think they've admitted that wrongs were committed. They said it right up front. So, but they'll deal with it. I don't want us to belabor the point. A point that has been considered, I take it as a matter for other bodies to look at, so that we can then move forward. But let me just ask them to take this.
But we need the official response to that. Thank you.
They have, but I will invite them back. Surgeon General.
Yeah, before the SG.
And yes, before the SG, my apologies.
My hand was up on some time.
Yes, Mr. Motle.
Yeah, thanks, Chair. I hope this meeting doesn't run to the same crisis that we ran to last week in terms of time. But it is quite unfortunate. It does not seem like the questions that we posed last week were noted by SG and or the delegation that we requested to come and clarify us on matters that are of concern. My question in particular, I don't think they were responded by either the assertion, the preface that was given by the SG. I asked some straightforward question, Chair. Maybe I must recap so that they note correctly. These are not new questions. Number one, I asked because I think it's Dr. Mnisi. If you will pardon me if I'm not pronouncing or misspelling.
Yes. Colonel Mnisi. Colonel Dr. Mnisi, correct. You are.
Dr. Mnisi, who then acknowledged that they knew, they were aware of the process. And the question was that if they knew, why did they bypass that process of not seeking approval prior to importation? Secondly, my second question was around the responsibility of General Chalice as a head of a project, Tucson.
Can we reserve? Can we reserve that for the chief lock?
Okay. Just to
Thank
recap, those are the questions that I asked. The third question, the third question was with regard to number of vials that they've procured versus the number of members of the South African Defence, which does not really tally. Thanks, Chair.
All right. Thank you so much. All right, and then Shelembe, let me just check if your questions have all been asked. Oh, I see. I think that all Shelembe's questions were dealt with at the last meeting. I think I contributed in dealing with some of them. I think there was a question about the involvement of the Department of Health and in the process, and the acknowledgement that there was some interaction at an interministerial level. I said Department of Health is not in the meeting and the minister is not in the meeting, so I would prefer us not to deal with those. Okay, so I think let me just check. Yeah, those are the questions that were outstanding from the last meeting. Let me come back to you, General. If you could attend to those that the colleagues have just point them out. Over to you, sir.
Thank you, Chair. I would like to apologize about the numbers because I didn't get into them. Apologies, Honorable Chair, because I didn't respond to that. First, I think I need to say this again, that the issue of expediency in the procurement, in the purchase, in fact, ordering purchase of this particular drug needs to be really considered. Because at the time, one was in a complete state of lockdown in the rest of this country and the rest of the world. And therefore, the acquisition and also the numbers that you need to put in place in respect of how much do you really need of interferon, leave the issues of registration and Sahpra and all that, let's leave them aside. If you were to make that consideration, I have got a total number of dependents of the SANDF, which is in the neighborhood of between 260,000 and 300,000. That's the total number of dependents. And this, by the way, excludes the military veterans. Now, if you have got that big a number, and the Minister of Defense was clear from the beginning that what we need to do, if we have got something that we think and we feel, and we, according to the research and collaboration that we have with other governing bodies or militaries outside the Republic, then don't use this medication only for your soldiers who are in uniform, but rather for the rest of the dependents, because it is going to affect families, so to speak, because we know that this is a virus of its own kind, and in respect of the way in which it doesn't select a certain type of a group of persons. It's a virus that infects everyone. So, therefore, that was the initial cutoff that we need to understand. In the last sort of presentation, it was clear that we're talking about 23,000 regular force members being put on the ground, boots on the ground. According to the understanding that we had of the use of this drug, it was then going to mean that you need to use 10 doses of this drug for a duration of 6 months and having to be repeated for a duration of 2 years. Now, which is why then the first batch, which is the one that came, it's a batch that talks to trying to address that philosophy. Firstly, Heberon, which is still our belief, by the way, is a drug that down the line is going to be utilized and taken out of the market as quick as possible. But in April, which was when the first batch came, it was at the time where we felt that because of the closing of the borders and also the fact that we're having these numbers of patients that we thought we would need to, in fact, one would have needed to have in the neighborhood of 1,900,000 of these files, if you do the correct calculation in terms of plans. But the essence is that at that time, when the rest of the governments were shutting down, including ours, there was that notion that was in the Surgeon General's mind, which is that of if there is medication that has been proved by the Cubans to be effectively functioning in their environment, evidenced by the fact that wherever they go, they actually move along with interferon for the purposes of protecting their own. Therefore, the SG found it prudent that it's necessary for us to do in the numbers that we have. So essentially, I hope that addresses the issue that you're talking about, Honorable. Now, I missed the other one, Chair. Sorry. Okay, I think one has dealt with the critical issues, but I think again, members of the committee should not shut the door on the military health service in terms of utilization of this drug for clinical trials. We might just find ourselves making history in respect of the efficacy of the drug. Obviously, all the necessary academic work is being done, and we're going to put it in place in such a way that the information that's going to come out of whatever studies that we're going to put in place is going to be of value to the rest of the world. I thank you, Chair.
Thank you so much, General. Are there any follow-up questions before I move off? Please be mindful of time, colleagues.
Chairperson, I will reserve my question for new questions because, again, mine was not fully answered, so I must accept that it will not be fully answered. So yeah, very disappointing by the Surgeon General, but I mean,
which one was not fully answered, colleague?
I've put it to him that it was reported that they knew it was unregistered, and why have they recommended still to and supported the decision to import drugs that was unregistered, and whether according to them they were not subjected to Sahpra for approval and registration and authorization of imports of drugs. So because the reports have been that SAMS has been against that and they have advised the MCC, but now it seems like the Surgeon General has got a different view, or he doesn't want to directly respond to that question.
I thought they've responded to it, maybe not in the way that you wanted to receive it.
Well, I put the question here. He has to respond to my question, not in terms of what he wants to respond to. It's unacceptable.
All right. Okay, we'll leave it at that. Colleagues, other question?
Is it now new questions?
No, I'm asking follow-up questions, but be mindful of the time in relation to the General.
Yeah. I've got questions to the Surgeon General.
Okay. All right. I think we've exhausted our discussion with the Surgeon General. Thank you.
No. New questions to the Surgeon General, sir. New questions to the Surgeon General. You've only allowed him in terms of last week's questions.
No. I asked if there are any follow-up questions.
Yeah. No, I have got questions.
Okay. You must ask those questions. You may ask those questions.
Thank you very much. Given what Sahpra and the Auditor General told us today, I want to know from the Surgeon General whether in SAMS they obviously deal with medicines on a continuous basis, and they have got a pharmacist and facilities. Whether they've got competent knowledge of the import and storage of medicine, and if that is so, why did they not inform Sahpra at the time that the medicine was coming into South Africa, and why did they basically then agree to the documentation that was, and it was told to us that did not show it as medicine but as extensions to Operation Project Tusano? That was the first question, and then secondly,
okay, Mr. Murray. Okay, let's understand each other on that one. We said a question that relates to the contract and it being utilized.
I'm not talking about the contract.
Okay, that's fine.
Yeah. Just in terms of their role and legal responsibility in terms of the importation of the drugs, and we know that they knew at the time it was not registered. So that was the one thing why they did not inform Sahpra when they imported that. And then I want to know if they want to do a clinical trial, and it's indicated that they have got the researchers and they have got the laboratories and the facilities to do that, and the staff. Now, if I hear what the professor has said and the CEO of Sahpra, that is obviously very, very specific requirement, and it must be placebo controlled. What would be the cost of this? Because if they are convinced, and if they were convinced last year already that they want to do clinical trials, I suppose they would have done a cost analysis to see, would it be necessary, would it be viable and affordable, and in terms of the current economic climate, whether he really thinks that the National Treasury will grant that money, and then lastly, why should both Cuba and China not do this as a global clinical trial? They are the ones who produce it. Thank you very much. That's
Mr.
a medical
Murray,
question.
No. I'm not going to grant those questions. You see, some questions are going to be subjected to a further process. The questions that relates to the application and the trial size and all that, the department is still in talks with Sahpra to define the parameters. Once that has been sorted, will then lodge the applications. Sahpra will then indicate at that time whether the application merits their attention, and the application will indicate whether they would have, depending on the size, they would have sufficient capacity to execute. All of that, I think it's still work in progress. We're not closing the issue entirely. We are simply saying that, okay, and this is work in progress, and this one will be subjected to further investigation. And I'm not too sure why you would want us to deal with that one when in fact we would have another bite on it. Is that really what you want us to do?
Chair, Chairperson, I really think that, we have got facts in front of us, and it was reported to us in the past and today. And, if the Surgeon General is a responsible person and the institution, remember, it was last week given to us that the Military Command Council do nothing without the approval and the consent of military health services. So if that is the case, then the Surgeon General has got a direct implication on these decisions that was taken. And I mean, if he cannot answer that, I mean, when will we get an opportunity to answer that?
Mr. Murray,
No, it's not fair.
No, there's no denying that wrongs were committed. I think they've admitted to that upfront. Okay, it's like now flocking
yeah, but they were collectively saying that there was wrongs, and I want to know, because it's about medicine and it's about health and it's about compliance with rules and regulations and laws. I want to know, why and how did the Surgeon General justify this? Because it was said it is him that is basically approved importation.
All right, Mr. Yes, Honorable Member Modise.
I think you are allowing Mr. Mahe to run this meeting amok, and he's now making a dialogue, and I think it's totally unacceptable. You are providing direction on how we must go on, and he wants to do things the other way, and it cannot be accepted. Thank you.
Thank you so much. Ms. Because your hand was up as well. Ms. Because, your hand was up as well.
No, Chair.
All right.
No, Chair.
Oh, it was not up. No, thank you so much. Please, can we accept that we have looked into these issues, but their work is, is receiving attention. Some aspects of it are receiving attention, and it depends on us to call for information at the right time. And it's then that we'll be looking now into those specific areas once there has been the exchange of information between the DOD, that is SAMS, and Sahpra. And there's also outstanding information that's between DOD and the AG. And once they've found each other, we'll go, and then we'll deal with it when it comes to us as a report. Thank you so much. It's just that we need to manage our discussion. Otherwise, not get to the, to understanding what exactly happened, and then leave the agencies that have a responsibility to take consequence management to deal with those. And now, can we then move to the third, and that is the Chief Log. Chief Log, thank you very much, Dr. Tabula, Surgeon General, Lieutenant General. Thank you so much. Chief Log, General Mbuli, and there were questions that were directed to your division, and over to you, sir.
Thank you, Honorable Chair. Thanks the members of the council, and the minister. Yes, it's true there were questions which were raised the last time, as Honorable Mundle has mentioned. He asked if what is the role that Major General Charles plays in project to the SIG to SAN. General Charles is the director to SAN. He's responsible to manage the Tusano contract. As it was presented last week, what is Project Tusano all about? That no, Project Tusano was born out of the agreement between the South African government on bilateral agreement between defense-to-defense relationship. The contract is structured in this form, that you have contract number TI 1701. That's the contract that looks into professional and technical services. Under professional services, you then include your medical services. Under technical service, then that's the contract that talks of the repairs that is done by the Cubans with the South African members. Then you have a second contract. That's TI 1702 that provides services of vocational training. The vocational training that is happening currently in Cuba when it comes to the training of our doctors, our technicians, those mechanics. Now, as I earlier mentioned, the issue of that, that contract, the professional part, it deals with medical service. I will then ask General Charles to further expand on his role on the contract as the director of the contract. Thank you, Charles.
Yeah. Just before we go to General Charles, General, what is a service, and who is rendering a service in terms of this contract? And three, who are the contracting parties to this contract? I understand it's yourself, this side, and on the other side, who is the contracting party? I'm trying to unpack this before we move to General Charles. What is the service? Who's rendering a service in terms of this contract? And who are the exact contracting parties in terms of this contract? Over to you, General Mbuli.
Thank you, sir. The contracting parties on this contract, as the authority has been given to the chief of the National Defense Force and his counterpart in Cuba. Then, what actually happened if the contract, if there is some amendments that needs to be done to the contract or a supplement, the two parties, before they sign any of the supplements, the requirements comes from the chief of services with their requirements. Then it gets processed and it's all in agreement. Then it's sent to Cuba. Cuba to look at the content of our requirements. What is this thing is required? It's there sent back when the other part of Cuba, the chief's counterpart in Cuba, when he has signed it, he then brought into South Africa for the chief of the defense force to sign. As we then move, if any, there is payment that has to be done under that supplement. That's the issue when we then say how the extension of a contract. It's an amendment, it's a supplement that gets signed, or the contract has been signed long before.
No, General. No. You're not asking the question. I'm saying even before we move to Mr. Chadis, General Chadis, we want to know who you procured the drugs from. Who is the supplier of the drug? The one that the contract was entered into with. So we're trying to understand the term service. I may not understand the term service, and who is rendering a service in this context. Before we get, just to understand the term service and who's rendering the service, and who are the contracting partners in terms of who is selling the drug to whom.
The contracting party is the SADF. The Cuban leg is Techno Import. I'll then this thing share. Was it's in this thing is written in the contract how this whole process this thing is being done. I'll then request Charles as the director to San, who manages the contract, to further explain that point. Thank you.
So you are not in a position to answer these questions. That's the reason why you are referring to the director, General Mbuli. These are specific questions that you are within your providence. The answers to them are within your providence.
Yes, sir. I'm saying that no, the contract, we, SADF, we when we spoke of the service, the contracting part, it starts from the SADF, because we ask who require that service from the Cubans. We utilize Techno Import as the Cuban element that we then handle the contract together.
All right. Now, are you taking full responsibility for what happened, General, as the head of the division?
I take full responsibility on it.
Thank you so much.
Chairperson,
all right.
Chairperson,
Yes.
can I maybe you've specifically asked who is the contracting parties, not only the contracting party on our side, and I think the response was the contracting party on the other side are the Cubans, and obviously that's not a contracting party, and I mean that General Ndabula must the CLOC must just respond to that specific one. I think that was not answered that you've asked.
Okay.
Chair, can you hear me?
Yes, I can hear you very well, sir.
All right, thank you. Chair, I think we are not questioning the contract, and we are not questioning the relationship with the Cuban. And there is no way we are going to even attempt questioning that. But the question was as to whether under Project Tusano, do they have the delegation or the responsibility to procure? Because my simple understanding is that if the SG has got requirements, because these requirements, because they are in their nature, should come from the SG, out of need analysis to say we will need interferon to protect our forces on the ground. It can't come from anywhere else. It falls within the ambit and jurisdiction of the SG. And the SG has got a procurement center that is assigned to deal with his requirements. Now, does Project Tusano have those capabilities of which I am not aware of? That is the question. Does they have any delegation to handle procurement? Thank you, Chair.
Thank you so much. I think your question speaks to the delegation. He is a director and responsible for Tusano, and whether he has enough delegations to go it alone, I don't know, but that will be explained what these delegations are in respect of this contract. Right? Over to you, Dr. General Chalice. You've listened to the questions. Please clear those out first before you deal with the questions pertaining to the contract. We want to know your understanding of service, and in this case, in this context, who is rendering a service? Number 3, who are the contracting parties? The buyer, the seller, and any intermediary, if there is any. Thank you so much. Over to you.
Honorable Chair and honorable members, thank you for the opportunity. And I think CILOC have actually indicated this thing as to who are the contracting parties and who's contracted in this case. We move from the premise that the authority for us to engage Cubans is based on the contract that we're referring to. But to be specific to the context, we are going to be talking about the supplement number 10. I'm not sure if members are privy to this supplement number 10, but if you look at paragraph 1.1.
Yes, okay. We don't have the contract. I wanted just to inform you about that, but you may take us through.
Yeah, I think it's important that we do that. Because it must not seem as if maybe as SANTF we are trying to hide something on what we are doing and how we invite the members to look at a supplement number 10, 1.1 of the contract. Among other things that we are talking about there, it's actually the service which members seem to want clarity on. When we refer to a service in this case, we are talking about medical doctors and the medication that came with them as a group or as an entity that we refer to as a service, a medical service. And it also says that the Cuban Defense Force, which contracted Techno-Import. Techno-Import is a government-owned entity. And the contracting party in this case is DOD, by extension SANTF, duly appointed to deal with that. Now, Honorable Mutle emphasized the issue of a delegation of a project to SANO to be able to procure these services. When you have a contract with any service provider, as Tusano, we don't, number one, we don't deal with procurement processes, but we manage the contract that has been reached between SANTF and the Cuban Defense Force. And we manage the deliverables of that contract. And among other deliverables of this contract is to provide medical services to the SANTF, and that's what we managed in this case. And the medical service that we are referring to is the military doctors and interferon, which becomes a service in our interpretation of the contract. That is why we are not talking about about an interferon as a line item, singled out as a line item. Probably director procurement deal with the procurement process and make sure that this interferon is delivered to SADF. But that's not how we thought at the time. We put this together as a medical service. So in this case, the procurement process was not followed because it was not necessary. We looked at the existing contract between the two countries and we set our requirements accordingly. And I think members would also understand, if for instance, you as an example, we have an existing contract on the IT, that contract is signed off by duly appointed officials. Any other part of our services that requires an IT item will simply go to the contracted party and give the requirements. And IT will be delivered and we pay. And that's how we manage this contract in this case. That's how we looked at it as a law provision. So the issues of delegation and the amount we spend on what has been delivered to us is not regarded as a financial delegation given to the director project to SAN. But what we do, we manage the deliverables of the contract as signed by both parties of both countries. And I'm going to pause there unless there's a further follow-up question on what needs to be answered on. But I invite the members to look at supplement number 10 of the contract number TI 17001 South Africa. Paragraph 1.1 subpara A. You will get the details there. Thank you.
All right. Has that contract been given to the AG?
Honorable Chair, all the file, all the documents which are required by AG has been given.
I'm talking about this contract. Has this contract been handed over to the AG?
Yes, sir. The original contract and the supplement that we are referring to.
So, General, you don't deal with procurement. You manage a contract. You're a contract manager. Is that correct?
I manage the deliverables of the contract.
All right. So you don't. You're not
of the contract.
All right. So you're not a contract manager. All right. Or you were not party to what you call procurement. You only manage what is delivered to you. All right, we've heard that. We wanted just to establish that. Thank you so much, General. Mr. Mutle, is your hand up?
Yes, Chair.
Thank
you for the opportunity. And I must indicate that I am not pleased with the response, as if we don't know what are this contractual obligation with various countries, in particular with Cuba. Maybe I must take this opportunity and highlight that I in my previous responsibility, I used to work with such contracts, and particularly there is the one that I worked with Cuba in relation to sports and what that contract entails. But procurement is something else. You see, what we seem to understand, and General Chalice maybe must assist all of us to understand, is that Project Tusano, let me just say, I seem to understand was that Project Tusano was meant to assist South African National Defence Force with technical aspects in all areas of their needs. Right? Be that as it may, anything that must be procured under the very same contract must go through a process that is outside his responsibility as he manages the contract and deliverables. For an example, it's simple. If the SG, you see, you can't come to the portfolio committee and say this was a package of a medical service, whilst we are dealing with a transaction that put the defense force in the spotlight as a result of a drug that is termed to be illegal in the country. Now, you can't come to us and say this was a package because it was part of the contract, that makes it okay for you to do what you did. So it can be correct. So if you are managing a contract and deliverable, does it mean that processes must be flawed? Is that what the contract is saying? Maybe General Charles must explain to us. If the contract says so, then we must be furnished with that contract so that we satisfy ourselves as well. Thank you.
Thank you so much, Mr. Murray. Thank you so much, Mr. Murray. Mr. Murray.
Thank you very much. Honorable Mutle said a couple of things that I fully supported. Chairperson, you recall when I asked the question to the Surgeon General, you said no, I must ask the CLOC about this, and that's about the procurement. That was who takes the responsibility for the procurement. Now it seems like it's neither, as I said, Surgeon General nor the Chief of Logistics that are the procurement party. So who in the South African Defence Force and South African Military Health Services is now the contracting party on our side, and the procure side, not even the contracting party, the procurer of this medicine. There's a few things that I find, for me, very, very strange. And obviously, I know, and maybe, this is a question to the Chief of the National Defence Force and the Minister, whether the South African Defence Force, when they operate and procure anything, whether it's services or products, whether they are bound by the legislation for importation and for procurement of any product, whether there are any exceptions to that under the current conditions and even the state of disaster. Because it seems like there's things being done, but nobody takes the responsibility for that. It's always someone else or something else, but it's never anybody. Major General Chalisi just said again that the supplement makes provision for doctors plus the medicine that they require. That is what he has said or directly implied. Now, the Surgeon General know, and we know it has been reported that this medicine is unregistered in South Africa, is not approved in South Africa for the purposes they required it, and is thus illegal. So how can they sign a contract knowing that they are transgressing the laws? And if it is, that is one part of it. Then the second part comes with, and I suppose that is the General Chalisi's responsibility in terms of managing this supplement, is the importation or the transportation of the medicine into South Africa. Because it seems like, and Sahpra has confirmed that today, that they were not informed at the time that the medicine was brought in. How was that done? Why was it not declared as medicine at Waterkloof Air Force Base and at OR Tambo? Because if that was the case, surely Sahpra would have been called to do what is necessary in terms of legislation. I want to ask the General Chalisi whether he's sticking to the reasons that they identified it as a biological warfare, and seeing that they're only managing it and has not made the decisions, whether it was the opinion from the South African Surgeon General and the Mesicmed and SAMS that this is a biological warfare that we are threatening with, and then further whether he stick to what he has said last week to us, that we were in a state of war. Now, what did they rely on? Who relied on the fact that we are in a state of war and therefore the PFMA and other legislation is not applicable? Because if I understand the Constitution, I think it's section 206, around about there, where it talks about the state of defense, and it is only the president that can declare a state of defense. Sorry, it's Article 204. It's only the president that can declare a state of defense, and he must report that to Parliament. None of that has happened. So what did they rely on, and why did they rely on all these things that is clearly illegal and transgression, as you have stated, Chairperson, of all the laws? If you can respond to that.
Mr. Marais,
yes, sir.
Marais, you are debating the issue. Please ask a pointed question, please. I'm trying to manage time. Don't debate the issue. You will debate it in Parliament, you will debate it in public, but in this meeting, we're asking questions, not debating the matter. And number two, you're asking them to, wait. You are also asking them to whether they still stick to their answer they supplied. I mean, what is the purpose of that? Because the answer is already part of our record. You are muted. You are muting yourself. You have muted yourself.
I'm asking, what did they rely on when they made such a decision, seeing that apparently it's not the Surgeon General either. So it was certainly decided by them, irrespective of the fact that they are only supposed to manage the contract.
Colleagues, if it is a question, it must be a question, not a debate, not a discussion. We're not discussing this. And any other question? And I would not expect them to debate with you. That's what this meeting is not for a debate. The debate will happen in Parliament at some other time, and not in this meeting. I mean, we are trying.
Cool down, Chairperson. Cool down, Chairperson.
Mr. General Charles, the contract with Cuba for Cuban doctors, who are the contracting parties in that contract? Is it the Department of Health, and or is it Department of Defense? Who are the contracting parties? When they touched down on the 27th of April, they were welcomed by the Minister of Health, who said that they came at our request. Now, what is the involvement of the Defense Force in inviting those over 200 Cuban doctors who landed on our shores to come and assist our government to combat the spread of disease? Over to you, sir.
Honorable Chair, thank you very much. I'm not sure if I must just respond to what you have just asked me now, or I must look at what Honorable Mutle and Marais said, but I think you've already protected me from Honorable Mutle that we must not debate, and I'm happy with that. But given an opportunity, we will be able to explain why we say certain things and how we say them. But to the point that you are actually raising, is that when they touched down in South Africa, there were 187 of them, and 29 of those were actually directed to SAMS, SANDF in this case. And
no. I'm not saying where they were deployed. I know some were deployed in other provinces, their numbers were given. I'm saying, who is responsible for that contract?
I don't know about the National Department of Health, but ours, the contracting party is the SANDF for those 29 military Cuban doctors.
Contracting I'm saying, who are the contracting parties in respect of that?
Or is Department of Defense and Department of Department of Health.
Okay. So I just want to you've answered. So
yes, in Cuba, say, it's the Department of Defense in Cuba, and still it's a techno import that actually brought them to South Africa. So they are part of the same.
No. We're talking about the doctors, the Cuban doctors that were just about 200 Cuban doctors who landed in this country at the request of. Hello, Mr. General Charles, what are you saying?
Yes, I'm emphasizing the fact that the military doctors who came to South Africa are part of this contract that we are talking about. Cuban Defense Force contracted techno import to bring those doctors to South Africa. In South Africa, it's the SANDF as a contracting party. That's why we are talking about Project Tusano. If it was not the case, we wouldn't be talking about Project Tusano in relation to the military doctors which came from Cuba.
Yeah, no. Only now you are, committing yourself to that statement. Initially, let me tell you what you said. You said from the numbers, about 200 that touched down in our country, about 29 were allocated to you. When I asked, who are the contracting parties in respect of those 29? You said the contract is between yourself, SAMS or DOD, and the Department of Health. That's what you told us. So we're actually making a follow-up.
Yeah, no, Chair, I was referring to the total number. Because my understanding was that you are saying when they touched down to the Republic of South Africa, who were the contracting parties of the total number? That is my misunderstanding. But what I understand now is that we are only referring to the 29 military doctors that came from Cuba. And the answer to that is SANDF and the Cuban Defense Force of those 29 doctors. In Cuba, again, it's techno import, and all of that is managed by the same contract we are referring to now. Thank you.
No, you have answered me, General. All right. Have you dealt with the other questions, General, before we move off?
So the issue of the contract itself, as raised by the Honorable Motle, the deliverables of Project Tusano related to the technical and professional services, and this talks to all what you see in South Africa, the Cuban mechanics working with our mechanics, and in response to the defense review that says and directs us to arrest the decline of our core capability as it relates to the prime mission equipment. That's number one. The second part of it, in order to sustain the first part that I've just given, is to train South African SANDF members. That's 02 contract. It's still part of Project Tusano. And 02 contract speaks to the training of the engineers, technicians, military doctors, aviation space as it relates to pilots and aviation technicians and engineers. That's the technical part or vocational part that I have to deliver on to see that the contract delivers on that. Now, when we talk about services, we refer to a military personnel that comes from Cuba to deliver a service to SANDF. Now, in this case, as an example, if we are to train pilots in Cuba, there's a requirement that these people or SANDF members must go through the aviation medical evaluation. And in that case, as we have done before, we have brought in medical doctors from Cuba to assist our doctors to evaluate these people on aviation medical issues. It's a service. If they come with their own testing apparatus and equipment and all of that to deliver on that particular deliverable, that's their prerogative. They will tell us what is it that they want to bring to South Africa to deliver on that particular deliverable. That's an example. The second one, to the context or to the subject matter, is the medical doctors which came to Cuba to provide a service in support of SAMS to our military operational requirement. And they came here with what they thought would actually assist them to make sure that our soldiers are immunized against the pandemic that we are dealing with. And that's how we judged and viewed this whole thing as part of the contract. Now, if there are technical questions which are related to that, those questions will probably be directed to the medical practitioners, not a military practitioner like me. I manage what has been agreed upon on the contract, and I make sure that it's delivered. Now, the issues of importation and transportation, the documents which we provided to AG, in all of those consignments from April, in July, and August, we have given packing lists. And that packing list it spells out what type of medication is in there and how it should be handled and how it should be transported. And SAA took a responsibility to make sure that this thing is transported adequately to our Tambo or Waterkloof. Those are the 2 points of entries which I think one of the honorable members referred to. They didn't even know which points of entries actually we used for this. It's Waterkloof Airport, Air Base, and Our Tambo. Those are the 2 entries. And in all of these, the medication was handed over to us as SANDF. And it took us between 1 minute to 40 minutes to actually transport this to the depot, at SAMS depot. And if the members would be probably interested as to whether there was a problem with how this thing was stored.
General, I said let's not discuss that which is still gonna be investigated.
Yes.
Better, like the temperatures, whether the temperature levels were breached during transportation. That is subject. You're in the meeting. Sahpra will look at that. And so please, can we just stay away from those so that we don't waste my time?
I'm comfortable with us, Chair. Thank you very much for that. And therefore, the issues then of the declaration as to whether this medication is now in South Africa and whether then we informed Sahpra in time or not, it's a matter of investigation, and that investigation will inform whether Charles was on the wrong or somebody else was on the wrong or the department was on the wrong. And we deal with that as part of the outcome of the investigation. If there is any other point that I need to respond to, I would welcome that, Chair. Thank you.
All right. It does. I think we have dealt. I don't see any hand on the system.
Yes, my hand is up, sir.
No. You have
Because
wasted
he
your
didn't
time.
answer my
No.
question. He didn't answer my question,
No.
sir. What did they rely on? What did they rely on when they made those decisions about biological warfare
No. You are taking it too far. You're taking it too far. I think, colleagues, there is an admission. There is an admission that the department, SAMS departed. The department, when I say the department, I include everyone who was involved, departed from the established practice, and in the process breached legislation. And the assessment that must be made is whether the action that they took was reasonable and justifiable, because they are saying that they were actually responding to an emergency. Whether they could have achieved better results had they acted within the law is another matter that must be looked at. What is clear from the presentation is that they foresaw the possibility that in carrying out the order, the unlawful results, that is irregular procurement, violation of pharmaceutical laws, and a possibility of fruitless and wasteful expenditure may be caused, but they reconciled themselves to this possibility. Look, it's not for us. The minister is in the meeting, has listened to all the presentations, and some aspects of which are still to be subjected to further scrutiny. And we can only now invite the minister to address us, now having the benefit of all sides. And the president said when he was addressing at the armed, what do you call it? What is this celebration? Armed Forces Day. Thank you so much. That when there are wrongs, the defense force would investigate the wrongs and take the necessary measures. Clearly, there are wrongs, and we expect that there be action. Now, the minister, when she addresses us, he will tell us, now that we have heard this, what action is she going to take, and to then try and get to the bottom, and that those who are responsible are held responsible. So those who are found to have transgressed the laws are held to account. And over to you, Minister.
Chairperson.
No. Hello? Yes, Mr. Shelembe. What are you talking about now?
No, Chairperson, I think one must raise a concern that, well, I think Mr. Marais is a member of the committee, but the manner he has been treated today, and he's got the right to ask questions. But I don't know, Chairperson, whether you were too emotional or something is going wrong. But it's better maybe if he is, direct, okay, you ask, but for you to say, no. It's like now, in short, Chairperson, he was unfairly treated in today's meeting. Thank you.
Chairperson, can I speak on that as well?
Sorry, not yet. I'm passing. Not yet, Minister. You are on the platform. May I invite you?
The Chairperson,
That is not it.
I would like my objection recorded to your approach to this meeting.
I don't know who you are. I don't know who you are. You have not introduced yourself. You have not been to our meeting.
Member
No. Wait. No, person. The rules of the meeting. The rules, Mr. Waters, Honorable Waters, don't spoil our meeting.
I'm not spoiling.
Coming in. You are attending this meeting for the first time.
You're not a committee member, Walters.
He's not even a committee member. You're coming to this meeting for the first time. I don't know how in the first place you were allowed in.
I'm invited. I'm an alternate.
No. Stay out. This is not the first time we're discussing the matter. No.
Listen, you should have heard me.
Minister, over to you.
Cool down, Chair.
Thank you so much.
Okay, Chair. Okay, thank you. Thank you very much.
Honorable Minister, good day.
Good day, Chairperson, and good day, honorable members. Good day, Chair, and good day, honorable members. And I must say that I've listened very attentively, starting from the presentation by the Office of the Auditor General. And of course, the presentation by Sahpra. One of the submissions I made last week when we were dealing with these issues and when you raised some questions directly to me, Chairperson, was that one, I'm just a politician like you. I am not a scientist. I am not a medical person. And therefore, whatever advice which relates to issues of medical related to the South African National Defence Force would be at the advice of the South African Military Health Services. However, Chair, I then said, I do take political responsibility for the medication which is there. What I did not know right at the beginning is that, in fact, the medication is not registered. However, it does not mean that because the medication is not registered, therefore, I must now step back and distance myself from that. I will not. But rather say, I've taken cognizance of the mistakes which have occurred along the way. I've also taken cognizance of the procurement processes which have not been complied with. But I also do want to say, Chair, that all of this came out as a result of a memo which was submitted by General Ford, which I have acted on. I have put together a team which is investigating two things. One, the issues raised by General Ford in his memorandum, and the second one, issues raised by General Sizani in another memorandum. And there is a team which has been put together. Terms of reference have been developed, and I don't know if I haven't given you the terms of reference. They may have been given to the Office of the Auditor General alone, but I can submit the terms of reference to you as well. Chairperson, you asked a question from General Chalisi. Allow me to set the record straight on this one, on the doctors. The doctors came at the request of the President of the Republic of South Africa, directly to the President of Cuba, at the request of the Department of Health. And of course, then you have a group which is allocated to the Department of Defense. I needed to clarify that because I felt there was a bit of confusion about where the request came from. The request came from the President at the insistence of both Health and the Department of Defense. Now, Chairperson, I do want us to still allow Sahpra to continue to work with the Department of Defense through SAMS to resolve all of the issues which have been raised here, both by Sahpra and the Office of the Auditor General. You see, for instance, this matter of the medication which may have been exposed to temperatures which are not suitable for the medication. This is a matter which I've read about in the media. This is a matter I've gone back to check with the Military Command Council in the presence of SAMS as to whether in fact this is actually true, because we read about it from the media. And I was assured that none of that had happened. So I would want to assume that some of the issues which have been raised here will come out of this investigation which is being conducted, including this particular matter, because if you are saying 287,000 vials were outside, were exposed to temperatures which are not suitable, we obviously have to go and verify. The people who are investigating must also look into that and verify that information. Now, there was a matter which was raised here, which suggests that there is reluctance to account to Parliament. Chairperson, there is no reluctance by myself to account to Parliament, and I have insisted on the members of SAMS through the Military Command Council that every bit of information which you have requested or which has been requested by the Office of the Auditor General relating to this should be submitted. So there's no reluctance to account to Parliament. Now, with regards to, let me not talk to issues of clinical trials. I don't want to venture into matters which I don't understand, Chair. Then you mentioned, Chair, that the military command went on to secure interferon in spite of advice contrary to that. I wasn't aware of that. In any event, these are all members of the South African Military Health Services. General Ford, General Ndlovu are part of the military health services, and there are other doctors and other scientists who are part of SAMS. So I wouldn't know what the debate would have been within SAMS. But within the Military Command Council, I am fully aware of the debate and the agreement to get this medication. You see, the other matter which has been raised here, you raised a matter as of who are the, I've written it somewhere, who are the contracting partners? You see, my understanding about this medication is that the contracting partners, the people we secured the medication from the Defense Force of Cuba, whether it is in government now or not, but everything in my understanding, when in fact, I thought the SG would actually indicate, because this is how the report was given to me, which is that we, Minister, we have been offered medication by the Cubans, medication which is believed not for COVID, but which raises the immune system so that people are able to fight against the virus. Medication which is being used already in China, in Italy and Spain, the areas where at the time the Cuban doctors had been deployed. And of course, I then said, you know what, whilst we are engaging, I'm going to raise the matter with the NCCCC. I'm also going to raise the matter with the president, because all of us at the time didn't know what we would need for this virus. And I said, you know what, ask them to block something for us, but let me go and raise the matter at the meeting of the NCCC. Now, Chair, The rest is history because that now has not happened. But the Defense Force continued to get its own on the basis of their military to military bilateral to get medication. Now, the matter is now at a point where it is fruitless expenditure. You've just said, Chair. Yes, Chair, it will be fruitless expenditure if this work which we are proposing should be done, because obviously, Chair, none of us want this to be a fruitless expenditure. Certainly, I don't want it. I'm not looking forward to it because it has serious implications for the Defense Force. However, my appeal right up until now, Chair, is that let us please continue to allow the process of engagement between Sahpra and the Defense Force. I accept that it was wrong of the Defense Force to bring it in before they had engaged Sahpra. Now, for me, I've learned so much now, these few days and these few months about Section 21, Section 22. Honorable Murray told us about Section 22. If you lay charges, the fine is 10 years. There's a fine and conviction, I think, and a 10-year. I didn't know about those things. What to me mattered at the time, Chairperson, I should say this and repeat it, when the matter was raised with me, that, you know, we are being offered, along with doctors, we are being offered medication by the Cubans. And when I said, yeah, I mean, so let me go, let me raise the matter. In fact, Chair, if you check even with the Minister of Health, she will tell you that the first person who brought the matter of Cuban doctors and medication to a meeting of the NCCC right at the beginning of this whole thing was me as Minister of Defense, only because the offer had been made to us, and I felt strongly that it would be incorrect of the Defense Force to get medication for itself when in fact the rest of the country is having a virus. Now, issues of techno, I don't know, techno what, the full name, as mentioned by Chadisi. I don't know that there's a techno whatever. What I do know is that the agreement and everything, including medication, which we got from Cuba, was on the basis of engagements between the Cuban military and the South African National Defense Force. So the rest of those kinds of detail about who manufactures, and my understanding in Cuba, everything, in fact, is military. Everything, it doesn't matter what you talk, it is research, everything is done by the military. And therefore, further clarity on those kinds of issues are issues which maybe you can take up further with General Dabula, just for him to tease out those issues maybe in another session about that aspect. So the issue is, what do I do? What am I going to do? Obviously, there has to be consequences where procurement processes have fallen short, or where there has been non-compliance with procurement processes. Then you said, Chair, what usually happens when there's importation of things? I don't know of other things which have been imported, but I am confining myself right now to this issue of the medication, which I must say is a matter which has been a very sore point, a matter which has been very difficult for me to deal with, because indeed, I was not aware, I did not know that we should have sought permission from Sahpra before we bring in medication. That I should be honest about. That is why I am saying I take full political responsibility for that ignorance. And of course, I know people maybe will say ignorance is no excuse, but that's the reality. I did not know. And then and obviously, as I said, what form of penalties should be there for people having gone the route they've gone in procuring this? Obviously, I'm going to need advice. I don't know, Chair, if there's a question which you raised with me last week, which I left out. But if I did, okay, there's a matter, Chair, of whether the medication did go through, was sanctioned by Port Health or even SARS for that matter. Chairperson. My understanding was precisely that. That is why I had the courage to stand up and say, this medication has not been smuggled into the country because it came through the ports of entry. So maybe then they can unpack what is it? Because you see now, even the fact that not all documents have been submitted to the Auditor General in relation to the clearance of the medication, it worries me. It worries me because I don't know why people would not provide the necessary documents. I've issued a directive, not now, in November already, when I interacted with the Office of the Auditor General, that all documents relevant to this should be submitted to the Office of the Auditor General. What else? Chairperson, I don't know if there's any matter I have not responded to which you have raised, but I should say this, that I am as concerned as you are. But I am not responsible for supply chain. I am not responsible for procurement processes, but the political decision and support to the SAMs when they said they are going to get medication, I did support. Thank you, Chairperson.
Thank you very much, Minister. Let me end with the words of the Commander-in-Chief when he was at the Armed Forces Day. He said, quote, "We know the SNDF to be a disciplined force. We know that the Defence Force will not accept any actions by its members that violate the laws of our country or the right of our people. We know that where there are transgressions, it will act against those responsible." I think you've just confirmed it, Minister, that there will be consequences. And so we will give you time to look into the matter. You have appointed a team to investigate into the issues. What has been the timeframes, Minister? And what was concerning, Minister, in the last meeting was that when General Charles was reporting, he said they are currently vetting the members of your that you have appointed to investigate into this matter. That's what he said. I'm not too sure if the vetting is done by.
No, Chair, they are not vetted by them. They are not vetted by them. They were vetted by state security. Not only that, then they signed letters of commitment not to disclose secret information other than submitting a report. Nothing to do with that.
Thank you so much. So when are you, have they been appointed, even letters of appointment?
Yes, Chairperson. Yes, they have been. And I'm dealing with that matter. 3 to 6 months. That's what we've given because of the nature of the issues, because it's not just the interferon which we are discussing. We are also looking at other matters which are relevant, which have been raised by another general. Also, thank you.
I just wanted to get that so that we know that the team has been appointed, yes, and that the period within which they must deliver a report is between 3 to 6 months. Colleagues, with that, let me thank you, Honourable Minister, for, I think you were honest with us, and you were able to admit that which happened and you did not know anything about, and that you will, in fact, take the corrective measures. With that, let us thank the Minister for this. Colleagues, the Minister and the Department are now excused. We'll then move to the next item. Minister, I will see you in the House in the next few minutes. I think in an hour or so. I hope there will be good news. I hope there will be good news for us.
Maybe not. I don't know.
Not,
maybe not. If there isn't, it wouldn't be because we made a mess with the interferon. Really?
No, certainly not.
You know, Chair, I do want to end my my remarks, Chair. I do want to end just by saying that, you know, Chairperson, we're not a perfect entity. We're not. But I do want us to remember that there have been occasions where we've had, once you say to members of the Defense Force, move. And you know, I don't know why Honorable Mare said it was not a state of war. It was a state of war, but with an invisible enemy. That we should say. But of course, what we cannot say is that it was a biological warfare, because there was never such analysis. But I do want to Chair to say that we've tried our best under very difficult circumstances, under very, very trying times, by the way, starting from the assignment which took us more than a week to embark, no, more than 3 weeks to embark upon, when we had to go and fetch young people in Wuhan. Chair, we survived the Central African Republic, we survived Sudan, we survived the DRC, we saved the DRC, we saved the VAL, we saved lives of people here in South Africa when there were strikes in hospitals. And we've supported government departments in combating crime, law enforcement, and in delivering basic services. And therefore, and I'm not in any way suggesting that the Defense Force has no potential to do wrong things. No, not at all. But I do want to say this. Right now, we are finding ourselves in a difficult situation where we have secured a medication which is not registered in South Africa, which I've not heard, I don't know from you, Chair, whether the World Health Organization does not recognize interferon. I heard the doctors and the professors mentioning that you have interferon A and then you have interferon B, whatever. But there are different types of interferon. I think that in whatever will come out finally, in judging the position and the conduct of the Department of Defense, please let us also take into consideration the conditions and the circumstances under which we found ourselves at the time. Thank you very much, Chairperson. Just to say, I'm sure you are aware that in one of the reports, for instance, I think it was removed by the Auditor General's office now, we used an aircraft, for instance, which did not, of a company, which it turns out to Wuhan. It did not have a tax clearance certificate at the time. And when this matter, we were dealing with the Auditor General in discussing these matters, that's one of the things they drew our attention to. Now, every time the Defense Force had used our own carrier, and no one knew that it did not have a tax clearance certificate to take to fetch our people in Wuhan. Now, if you look at that, I really had to plead that we cannot be penalized for this, because if it was a government to government agreement, we wouldn't have known that SAA at the time did not have a tax clearance certificate. So I'm just trying to point out and indicate to you some of the mistakes which you may look at and say they are small, but clearly now they may have very serious consequences, because that's one of the things which happened during that period. We got to know way later when an audit was being done. So, Chair, we will continue to meet. We will engage with you once the first report comes out. We will come and of course, it also is very difficult sometimes to confide about everything, because sitting here on this platform, we don't know how many people are sitting on the platform, but obviously we would interact with the committee, maybe even outside, maybe even this interaction wouldn't be turning out like this, would have even had a better interaction where we're meeting physically and engaging on these matters and confide in the committee about the challenges which we have encountered. Thank you, Chairperson. And thank you, honorable members.
Thank you so much. Thank you so much, Minister. The team is also excused. All right, colleagues, we still have 5 minutes to go. With minutes, I'm not too sure. Can we deal with the minutes? Brian, can you bring up the first set of the minutes?
Chairperson?
Yes, sir. Mr. Murray?
I was very polite and not interjected when the meeting went on with the minister and the others. But you will probably disagree with me. But today, you certainly did not allow my questions, which I feel is very, 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 very relevant. And I must just register my very huge disappointment that there was important information. The minister, to a certain extent, responded to that, which you, in my opinion, protected the Surgeon General and the Chief Logistics. And they are actually supposed, because they have again made claims today that is so bizarre. But obviously, they were allowed to get away with that, and I was not allowed to get a response to my answer. So I must register my incredibly disappointment, and I've never expected this. So that I must do that. I must put it on record. Thank you.
No, thank you so much. But colleagues, when it is question time, they must ask questions and not enter into a debate, lengthy debate for that matter. We have time, and we must try and conserve it so that we are able to, do justice to our work. That's number one. And number two, and this matter is not resting. And the minister is set up a team to investigate it, and at some point it will come back to us. That's one. With all the answers that you have been asking, Mr. Mare. Number two, the Sahpra is conducting further investigation, and at some point it will come back to us with all the answers to the questions that Mr. Mare, to some of the questions that you have raised. The AG, again, it's again looking into some of the issues that they could not look at due to the limitation of scope. And that too will come back to us. So now is when you want to belabor the point, when in actual fact there are processes in place and to take care of the issues and investigate them and report on them back to us at some point. So I don't want us to waste time. Let's use our time responsibly. All right,
but with the greatest respect, sir, you cannot prescribe to us how we must ask questions, and you cannot assume on behalf of some of the other persons that we are asking the questions to what is actually justified and what is not. I mean, it's for them to answer, and it's our free will and democratic right to ask the questions. Certainly, I mean, I'm allowed to ask the questions, and they must respond to that. I mean, there cannot be embargoes on what we can ask and how we should ask it.
Questions I will allow. Questions I will allow. But it's a debate. But no, Mr. Murray, you like debating. You are now debating.
They did
you are
not
now debating
my questions, and you allowed them to get away with that. It's unacceptable.
You are now debating. No, you are not dealing with this issue in a polite way. Can we move forward and deal with the issue that I've called? And the minutes, can you deal with the minutes?
Chairperson?
Can you deal with the minutes?
Chairperson, I want to raise a matter.
Can you deal with the minutes?
Yes, Chair.
Well, Chairperson, I would like to raise a matter.
So, look, colleagues, you've eaten, the time is now 1 o'clock.
Are you overruling me?
It's now 1 o'clock.
Chairperson, deal with the minutes, please. We want to log on to Parliament.
I've been overruled. Can't raise the matter. Thank
no,
you.
you're not overruled. We're dealing with the minutes. You'll comment when we deal with the minutes.
Chairperson, but before we get to the minutes, Chair, I raised my hand way before you will move to the minutes.
Colleagues, the time now is 1 o'clock. The meeting was set for 10 to 1. And it does seem that, how many sets of minutes, Brian, do you have today? On the agenda, I think 3 or 4. Will not be
we've got 4 sets of minutes, Chair.
Correct. We'll not be able to do justice to the minutes. And what remains for me now is to thank you for your participation. I know some of us have to, I'm at the village. I'm yet to organize transport to take me to Parliament. I'm sure all of us are in the process of arranging our way to Parliament or to listen to the speech. With that, colleagues, thank you very much for your time, and with the meeting stands adjourned.
Thank you, Chair.
Thank you so much.
Thank you, Chair.